In this recording, we're going to assess the view that developing countries should adopt Western-style healthcare systems and practices. So, all over the world there has been a considerate progress over the past 30 years, which has increased life expectancy in a lot of countries, but in some countries there has been a slip backwards. Good health provision is essential for protection of people and for developing countries' future prospects. Modernisation theory believes that we are now facing an epidemiological transition in the world, meaning that there is a move from infectious diseases killing people to diseases of affluence such as heart disease. The way to combat this would be to move to a more centralised government-controlled medical system which can immunise people against infectious diseases on a mass scale. Health patterns in developing countries should follow the same patterns as the developed world did in the past because Western medicine is superior and health education can save the problem of high infant mortality and low life expectancy. And Rostow argues that high technological medicine used in the developed world should be transferred to the developing nations to aid so that high quality care can be provided. However, the problem with modernisation theory is that they support the idea of developing nations adopting Western healthcare systems, but Western hospitals are often costly and developing countries cannot afford such vast health systems. For example, Senegal is one of the world's most indebted country, and if this system was imposed on them, then they would become even more in debt. Therefore, modernisation theory needs to find a cheaper alternative. Also, centralised hospitals would be in urban areas, which excludes the rural areas which are in great poverty. And doctors who are trained in this system have no incentive to stay in developing countries because they may not be paid very highly. If doctors choose to stay, then they often will only work for urban elites, but a lot will leave the country, resulting in brain drain and the population migration to the west. For example, in Bulgaria, 40% of students are educated at university level abroad and 80% choose to stay in the country they studied. So, dependency theory takes a more negative approach of Western education, as Frank argues that developing countries cannot be expected to follow the West's shadow and adopt their healthcare system because colonialism and neocolonialism has changed health. For example, TNCs polluted the environment to gain profit, and this resulted in health issues in developing countries. The lifestyle of the rich has led to cancer and heart disease, but the power of TNCs allows them to advertise and sell products irresponsibly. For example, baby formula milk is heavily advertised in developing countries, but some mothers don't have access to clean water to make the milk with, so many babies die from infections. Or poor mothers may water down the formula to try and make it last longer, but this will result in malnutrition. However, the problem with dependency theory is that new health problems like tooth decay is not always a sign of exploitation, but it's a sign of new health problems which could be solved by dentists in a Western model of healthcare. Neoliberals believe that as the Western model for healthcare is state-run, this would not benefit developing countries because they will have to provide a system through taxation, which it does not collect because people are not educated enough to get good jobs to pay tax. Neoliberals argue that Western models are inadequate and privatised systems will be better because they would compete by lowering prices for the poor, so privatised systems would be better in developing countries. However, the problem with neoliberal theory is that only the rich will benefit because the poor will not be able to afford even the most basic healthcare. So we move on to the last topic, which is choice, and developing countries face a choice between selective biomedical intervention, and this is immunisation campaigns would try to prevent the spread of disease. However, the problem with this is that it can't be easily sustained because it may prevent one disease at one time, but it may not rule out another one later. So the second choice is comprehensive primary healthcare, and this includes an emphasis on healthcare education and prevention of disease, such as draining ponds so mosquitoes can't breed. In conclusion, healthcare needs to be based on country to country, as each one has different rates of tax, and grassroots aid to vaccinate and teach healthcare to local communities would be a more cost-effective method than the Western model of healthcare.